Did you know that being deficient in just one specific nutrient can literally double your risk of having a heart attack? I'm talking about a deficiency that affects over 60% of women over 40, and most of us have no idea we're walking around with this silent threat. What's even more shocking is that this isn't some rare vitamin you've never heard of. It's something your grandmother probably knew was important, but somehow modern medicine forgot to tell us just how critical it really is for keeping our hearts strong and our arteries clear. Stay with me because what I'm about to share could literally save your life, and the best part is, fixing this deficiency is easier and more natural than you might think. Before we dive deep into this life-changing information, I want you to hit that subscribe button right now. This channel is dedicated to giving you the natural, science-backed solutions you need to age beautifully, stay healthy, and feel amazing in your own skin. Every week, I share the kind of information that can transform your health naturally, without relying on medications or complicated treatments. Your future self will thank you for staying connected to this community of women who choose natural wellness over quick fixes. Now, let me ask you something. Have you ever wondered why heart disease is the #1 killer of women, especially after menopause? Why do so many of us who eat relatively well and try to stay active still end up with high blood pressure, clogged arteries, and heart problems? The answer might surprise you, and it has everything to do with something that's been hiding in plain sight. The nutrient I'm talking about is magnesium. Yes, magnesium. I can almost hear you thinking, really? That's it? But hear me out, because this is where it gets fascinating and frankly, a little scary. Magnesium is involved in over 300 biochemical reactions in your body. Think of it as the spark plug for your heart, your muscles, your nerves, and your entire cardiovascular system. Without enough magnesium, your heart literally cannot function properly. Here's what happens when you're magnesium deficient, and trust me, you'll recognize some of these signs. Your heart starts beating irregularly. You might notice palpitations, especially at night when you're trying to sleep. Your blood pressure starts creeping up because your blood vessels can't relax properly. You feel more anxious and stressed because your nervous system is on high alert. Your muscles cramp, especially in your legs and feet. And here's the kicker, your arteries start getting stiff and narrow, creating the perfect storm for a heart attack. But here's what makes this even more concerning for us women over 40. As we go through perimenopause and menopause, our magnesium needs actually increase, but our ability to absorb it decreases. It's like a cruel joke our bodies play on us right when we need this nutrient the most. Estrogen helps our bodies use magnesium efficiently, so when estrogen drops, we're suddenly at much higher risk for deficiency. And here's something that will probably make you angry. The standard blood test that most doctors run to check magnesium levels only measures the magnesium in your blood serum. But here's the problem, less than 1% of your body's magnesium is in your blood. The rest is in your bones, muscles, and organs. So you can have what looks like normal magnesium levels on a blood test while actually being severely deficient where it really matters. Dr. Carolyn Dean, who's been researching magnesium for over 20 years, calls this the magnesium miracle, because when women start getting adequate magnesium, their heart health transforms almost immediately. She's seen women reverse irregular heartbeats, lower their blood pressure naturally, and dramatically reduce their risk of heart attack and stroke, all by addressing this one deficiency. Let me tell you about Sarah, a 52-year-old teacher from Ohio who came to see me last year. She was exhausted, having heart palpitations that kept her awake at night, and her doctor wanted to put her on blood pressure medication. Her blood pressure had been creeping up for months, and she was scared she was heading toward a heart attack like her mother had. Instead of immediately jumping to medication, we decided to test her cellular magnesium levels, and guess what? She was severely deficient, even though her regular blood work showed normal magnesium. We started her on a comprehensive magnesium protocol, focusing on both dietary sources and high-quality supplementation, and within 6 weeks, her blood pressure had normalized, her heart palpitations were gone, and she was sleeping like a baby. Her doctor was amazed and told her to keep doing whatever she was doing instead of starting the medication. But here's where it gets really interesting. Magnesium doesn't just prevent heart attacks by keeping your heart rhythm steady. It actually works like a natural calcium channel blocker. Now, you've probably heard that calcium is good for your bones, which is true, but too much calcium without enough magnesium can be dangerous for your heart. Calcium makes muscles contract, including your heart muscle and the muscles in your artery walls. Magnesium makes them relax. When you don't have enough magnesium, calcium can build up in your arteries, making them hard and narrow. This is exactly what we see in atherosclerosis, or hardening of the arteries. It's like having a garden hose that gets stiffer and narrower over time. Eventually, something's got to give, and that's when heart attacks happen. This is why I always tell women that if you're taking calcium supplements, you absolutely must take magnesium too. The ideal ratio is about 2 parts calcium to 1 part magnesium, but most of us are getting way too much calcium from dairy products, fortified foods, and supplements, while getting nowhere near enough magnesium. So where has all our magnesium gone? This is the million-dollar question. 50 years ago, you could get plenty of magnesium from eating a normal diet. But today's food supply is drastically depleted in this crucial mineral. Our soils have been stripped of magnesium by industrial farming practices. The vegetables and grains we eat today contain about 25% less magnesium than they did in 1950. But that's not all. Our modern lifestyle is actually depleting our magnesium stores faster than ever. Chronic stress burns through magnesium like crazy. Every time you feel stressed, anxious, or overwhelmed, your body dumps magnesium. Coffee, alcohol, and processed foods all deplete magnesium. Even prescription medications like diuretics, acid blockers, and antibiotics can wipe out your magnesium stores. And here's something that really gets me fired up. The standard American diet is loaded with foods that not only don't contain magnesium but actually steal it from your body. Refined sugar is the worst culprit. Every time you eat sugar, your body has to use up precious magnesium to process it. So that afternoon cookie or evening glass of wine isn't just empty calories, it's actually making your magnesium deficiency worse. But here's the good news, and this is where we can take control naturally. Getting your magnesium levels back up isn't complicated, but it does require some knowledge about what works and what doesn't. First, let's talk about food sources because this is always where I like to start. The best dietary sources of magnesium are dark leafy greens like spinach, Swiss chard, and kale. Nuts and seeds are magnesium powerhouses, especially pumpkin seeds, almonds, and Brazil nuts. Dark chocolate with at least 70% cacao is actually a great source of magnesium, which gives us all a reason to smile. Avocados, black beans, and quinoa are also excellent choices. But here's the reality check. Even if you eat a perfect diet loaded with these magnesium-rich foods, you're probably still not going to get enough to correct a deficiency, especially if you're over 40 and dealing with hormonal changes. This is where targeted supplementation becomes crucial. Now, not all magnesium supplements are created equal, and this is where a lot of women get frustrated. They try magnesium and don't feel better, so they assume it doesn't work. But the type of magnesium you take makes all the difference in the world. Magnesium oxide, which is the cheapest and most common form you'll find in drugstores, is barely absorbed by your body. You might as well be taking chalk. Magnesium citrate is better absorbed, but it can cause digestive upset and loose stools in many people. The forms that I've found work best for heart health are magnesium glycinate, magnesium taurate, and magnesium malate. Magnesium glycinate is bound to the amino acid glycine, which makes it very well absorbed and gentle on the stomach. It's also calming, so it's perfect if you're dealing with anxiety or sleep problems along with your heart concerns. Magnesium taurate combines magnesium with taurine, an amino acid that's specifically beneficial for heart health. This combination is like a 1-2 punch for cardiovascular protection. The amount matters too. Most women need between 400 to 600 milligrams of elemental magnesium per day, but if you're deficient, you might need more initially. I always recommend starting with a moderate dose and gradually increasing it, because too much too fast can cause loose stools. But here's a secret that most people don't know about magnesium absorption. You absorb it better when you take it with a little bit of vitamin D and some healthy fat. This is why I often recommend taking your magnesium with dinner or with a small snack that contains some good fats like nuts or avocado. There's also something called transdermal magnesium, which means absorbing it through your skin. Epsom salt baths are a wonderful way to increase your magnesium levels while also reducing stress and promoting better sleep. The magnesium sulfate in Epsom salts can be absorbed directly through your skin, bypassing your digestive system entirely. I recommend soaking in a warm Epsom salt bath for 20 minutes, 3 times a week. Magnesium oil is another transdermal option. Despite its name, it's not actually oil, but a concentrated solution of magnesium chloride that feels oily on your skin. You can spray it on your legs, arms, or torso before bed. Some people find it a little tingly at first, but that sensation usually goes away as your magnesium levels improve. Now, let's talk about the timeline because I know you want to know when you'll start feeling better. Some women notice improvements in their sleep and anxiety levels within just a few days of starting magnesium. Heart palpitations often improve within the first week or 2. But for significant changes in blood pressure and overall cardiovascular health, you're looking at about 6 to 8 weeks of consistent supplementation. And here's something beautiful about magnesium that makes it different from medications. The benefits compound over time. The longer you maintain adequate magnesium levels, the better your heart health becomes. Your arteries become more flexible, your blood pressure naturally normalizes, and your risk of heart attack and stroke drops significantly. But magnesium isn't just about preventing heart attacks. As your levels improve, you'll likely notice that you sleep more deeply, feel less anxious, have fewer muscle cramps, and just feel more energetic overall. It's like giving your entire body a tune-up. There are some simple ways to know if your magnesium levels are improving. That eye twitch you've been dealing with? It'll probably disappear. Those Charlie horses that wake you up at night? Gone. The tight feeling in your chest when you're stressed? Much better. Your heart rate will become more steady and calm, especially during stressful situations. I want to share one more story with you because it really illustrates the power of addressing magnesium deficiency. Linda, a 58-year-old woman from Texas, came to me after having what her doctors called a mild heart attack. She was put on multiple medications, but she was determined to address the root cause naturally. Her cellular magnesium test showed severe deficiency. We worked together to create a comprehensive magnesium protocol that included dietary changes, high-quality supplementation, stress management, and regular Epsom salt baths. 6 months later, her cardiologist was amazed at her improvement. Her ejection fraction, which measures how well her heart pumps blood, had improved significantly. Her blood pressure was normal, and she felt better than she had in years. Now, I want to be clear about something important. If you're already on heart medications, you should never stop them without working with your healthcare provider. But magnesium can be a powerful complement to conventional treatment, and many women find that as their magnesium levels improve, their doctors are able to reduce their medications. The key is working with a healthcare provider who understands nutritional medicine and can monitor your progress. Unfortunately, not all doctors are educated about magnesium deficiency, so you might need to advocate for yourself or find a practitioner who specializes in integrative medicine. Here's what I want you to do starting today. First, take an honest look at your symptoms. Are you dealing with any of the signs of magnesium deficiency we talked about? Heart palpitations, high blood pressure, muscle cramps, anxiety, or sleep problems? If so, consider getting your magnesium levels properly tested, not just the standard blood serum test, but a cellular magnesium test or a red blood cell magnesium test. Second, start increasing your dietary magnesium intake. Add more dark leafy greens to your meals, snack on a handful of almonds or pumpkin seeds, and yes, enjoy a square or two of dark chocolate. Every little bit helps. Third, consider high-quality magnesium supplementation. Start with magnesium glycinate or magnesium taurate, beginning with a moderate dose and increasing gradually as your body adjusts. And finally, manage your stress levels. Remember, chronic stress depletes magnesium faster than almost anything else. Whether it's through meditation, yoga, deep breathing, or just taking time for yourself every day, reducing stress is crucial for maintaining healthy magnesium levels. I hope this information empowers you to take control of your heart health naturally. Remember, you don't have to accept that heart disease is inevitable just because you're getting older. By addressing simple nutritional deficiencies like magnesium, you can significantly reduce your risk and feel amazing at the same time. Before you go, make sure you're subscribed to this channel because we're just getting started on this journey to natural heart health. Every week, I share evidence-based strategies that can transform your health without relying on medications or complicated treatments. Your heart and your future self will thank you for staying connected to this community of women who choose natural wellness. Now, speaking of protecting your heart naturally, there's something else I discovered in my research that absolutely shocked me. There's a common food that many women eat at night thinking it's healthy, but it's actually increasing their risk of heart problems while they sleep. This is especially dangerous for women over 50, and chances are, you might be eating this food regularly. I'll be sharing exactly what this food is and why it's so dangerous for your heart in my next video. Make sure you don't miss it because this information could literally save your life.